Greetings to all. I am Nawrocki from Dental Arts San Diego. This video is not about if you should go and see your dentist regularly and how many times you have to brush and floss. This video is about how to take control of your health and where everything starts. A lot of patients ask me two questions. One is, why would I do the gum therapy? And the second one, aren't my gums supposed to bleed? They always bleed, so what's the big deal? It is a huge deal. It's a disease. Our mouth is amazing. It is filled with life. We have 700 types of bacteria in the mouth that seeds the GI tract to a tune of 1 trillion bacteria daily. And if you compare the number of the bacteria in the GI tract to the number of cells in the human body, that would be the ratio of 10 to 1. Did you know that this bacteria is causing stomach ulcers and can be directly tracked to the dental plaque? So by reducing the bacterial counts in the mouth, you can actually reduce your risk for stomach ulcers. These bacteria are found inside of the atherosclerotic plaque, not only in the heart, but also in the brain. A lot of people seem to be confused on how the atherosclerotic plaque grows. They seem to think that you have to have an uncontrolled high blood pressure and high cholesterol for that to develop. Not necessarily 100% true, because for the atherosclerotic plaque to grow like a snowball until it actually occludes the blood vessel, it has to have that sticky bacterial component that is released by the bacteria in the bloodstream. So the question is this: how did the bacteria get to begin with from the mouth to the heart and the brain through the bloodstream? Through the bleeding gums, of course. In 2011, researchers discovered that this bacteria is found in large concentration in the colon cancer cells. And this bacteria has a specific nasty enzyme that is responsible for the process of citrullination in the body, which is actually modifying the proteins in the body and the human DNA to the point as if somebody would have a latent or sleeping gene for rheumatoid arthritis, for example, or multiple sclerosis. They will be able to wake up this gene and develop the active condition of a disease. Our immune system is such a strong defender of our well-being against this bacterial invasion that while at war, watch what happens. You are going to see a video in which the patient comes in with a long-standing infection. He developed a large abscess in his bone tissues that is making him very sick, very tired. I am releasing that tension and that infection, that bacteria and that decayed and dead cells of the body. Everything comes out with an enormous amount of pus. In a couple of days, the patient is back to his energy level. Everything is starting to heal and looking better, and the patient is moving towards being healthy again. It is easy to prevent this from happening by knowing exactly what you have in your mouth. Salivary DNA testing is available for everyone. Salivary DNA testing can tell you at what level of inflammation is the body currently, what type of bacteria is in the mouth, and in what quantities. Is there any risk of heart attack, stroke, rheumatoid arthritis, colon cancer, and diabetes present today? Oral DNA testing can also show the exposure to HPV, STD, herpes of both types, type 1 and type 2, and a range of inflammatory enzymes. I am Nawrocki. Always a pleasure. Till next time.